Today we'll be talking about oral hygiene and why it is so important for the holistic health of an individual. So oral hygiene is really important because it keeps our teeth from decaying and getting gum disease and just keeping our oral cavity nice and clean, which helps prevent infection. Periodontal disease can contribute to cardiac disease. And having good hygiene keeps your breath smelling good and your teeth nice, which is important for like smiling and talking, communicating, eating, all of those things that are important for daily living. Additionally, in long-term care facilities, older patients can have drier mucous membranes, so this is especially important for preventing infection.
And oral hygiene in general can be delegated to assisted personnel. However, it's recommended that the nurse usually conduct the first assessment, mostly to gauge the baseline health of the patient's oral cavity, as well as to assess the gag reflex of the patient. This is especially important because they could be at risk of aspiration, and so it's important that the nurse assess that before delegating oral hygiene tasks to assisted personnel. Here's some of the equipment we'll need to do oral hygiene. You'll need gloves. You'll don these after doing your hand hygiene. A tongue depressor and a pen light. You'll use these when you're assessing the patient's oral cavity. It's important to check around their whole mouth to look for any sores, cuts, abrasions, broken, cracked teeth, and just the overall health of the membranes, and if they're particularly dry or if they're moist and pink. You'll also need a soft bristle toothbrush and non-abrasive fluoride toothpaste, or in some cases you may use CHG, which is chlorhexidine gluconate, and this can be really important for intubated patients who are at a higher risk of pneumonia and other infections. CHG has higher antimicrobial properties and helps prevent that. You'll also want some rinsing cups. You can use a small amount of saline, or if the patient is responsive and able to rinse on their own, they can use water or even mouthwash, as long as they're not at risk of swallowing any of it. You also need some towels that you can use to clean the patient's mouth once you're done. A nemesis basin for the patient to spit into and discard their rinse. And sometimes you may want to have sponges just for moistening the oral cavity of some patients.
Okay, so now that we're going to be assessing the patient, it's important to have an understanding of the patient's past medical history. So that would be something you do before seeing the patient, is understand maybe any oral history that they might have, such as procedures or anything like that. Now that we're in the room, it's important to have an understanding of how much the patient knows about oral hygiene. So we're going to start asking some questions, such as how often does this patient brush their teeth? If so, how do they brush their teeth? What kind of toothbrush do they use? What kind of toothpaste do they use? If they use mouthwash, if they floss, if so, how often, time of day that they may floss, also time of day when they brush their teeth. All these things to understand how much the patient is caring for their oral hygiene. Another important one to ask is if they see the dentist, if so, how much, and if they have a certain history with going to the dentist. So we'll ask all the patient those questions. After that is done, we'll do the actual assessment of the mouth by looking inside. So what we'll do is perform our hand hygiene, and then we'll put on our gloves. Now we'll use the tongue depressor and the pen light to take a look into the oral cavity itself. So have the patient maybe say, get the tongue depressor in there, and then using the pen light, we're gonna check all the different structures of the mouth, such as the mucosa lining the gums, the lips, and the teeth. We're gonna be looking for periodontitis, which is receding gum line, gingivitis, which is inflammation of the gums. We wanna make sure that the mucosa is looking healthy, that it's moist, that is pink. We'll make sure that the lips are also moist, that they're not cracked or dry, that the tongue isn't cracked or dry. Make sure that the teeth are all intact, that they're not cracked or broken in any way. We're gonna take into factor things like smell as well, that they might have bad breath, that could mean an infection. So we're gonna take note of any discoloration, any browning of the gums, whiteness, anything like that. And then after we do our assessment of the oral cavity, we will dispose of the tongue depressor, and then we are going to dispose of the gloves and perform our hand hygiene.
All right, so now that we've assessed our patient, we're going to explain the procedure to our patient and the skill that we're going to perform and see if they're able to help us with it. In this case, our patient is not, so I'm going to be performing the skill for her. So we're going to do some hand hygiene and then apply our gloves. And then we're just going to make sure that we have a towel or paper towels laid out on our table as a barrier, which we do, and a towel on her chest just so she doesn't spill on her gown. And then we're going to take our toothbrush and our toothpaste, and we're going to make sure to apply toothpaste to cover all of the bristles. And then we're just going to pour a little bit of water over it.
Okay, now that we've got toothpaste on our toothbrush, we're going to start to brush our patient's teeth. We're going to go at a 45-degree angle to the gums for our outside and our inside of our teeth. We're also going to come parallel to the biting surfaces of our teeth that come in contact with food, tops and bottoms. And we're also going to make sure that we get the tongue nice and clean with the toothbrush. And so our patient's going to need to spit at some point into this, and they would spit into the basin. But like Juno, some of our patients aren't going to be able to spit because of their level of consciousness or their motor abilities or cognitive abilities. In that case, we would have other personnel in the room already for this type of patient, and they would use a suction to get that liquid out of our patient's mouth. Additionally, in really extreme cases, we might be performing this in a side-lying position for unconscious patients at risk of asphyxiating.
Once you've completed brushing, you'll want to make sure the patient's mouth is well rinsed. And you can, if they're awake, you'll have them rinse for 30 seconds with water or an antiseptic solution and spit into the emesis basin. If they're not, you'll need another team member with you, as we showed previously with the Yankauer performing suction. Once you're done, you can use the towel to clean the patient's mouth, around the lips. And then you'll want to use your pen light and a tongue depressor again to reassess the oral cavity. And you're going to want to make sure that you've brushed everything really well, that you haven't missed any spots, and also that the rinsing was effective and thorough so that the patient's not at risk of swallowing toothpaste. It's really important to match the patient's condition to your level of intervention and care. So you want to promote autonomy as much as possible. So if the patient is awake and able to brush their own teeth, you want to encourage that. And you also want to incorporate education as much as you can at the end of the brushing. And you'll want to have them use the teach-back method to demonstrate to you that they understand what you've been talking to them about. For example, you could ask them, can you show me how you're going to floss your teeth moving forward?
So alternatively, if this patient had dentures, we'd do all the same steps going up to the oral assessment, which I performed earlier in this video, but instead of doing oral hygiene with the toothbrush, we'd now do denture care. So the first step that we would do to perform that denture care is we would sanitize our hands, perform proper hand hygiene. We would then don on our gloves. And then using a 4x4 gauze, we would take the first denture out. So for purposes, we would take the first, grabbing with our index finger and our thumb, and then taking out the denture, and then putting it into the emesis basin, which is filled with water. And then we would take out the lower denture, also grasping with our thumb and index finger. If the patient is able, the patient can also take out the dentures themselves. After we have removed the dentures, it's important to reassess the oral cavity. So we'll take our tongue depressor and our pen light, and we will reassess the oral cavity. Again, we're looking for any discoloration. We're going to be looking for the teeth, the gums, We're just looking for everything to, if there are any teeth left, anything intact. We're making sure the mucosa looks well and that the mouth is in good condition.
So we've got our patient's dentures over at the sink now. We would ask to bring them over here if that's something they were willing and able to do, but I'm going to perform this on my own. I've got a towel covering the drain of the sink before I start anything, and I am going to apply some cleaning agent to my soft bristle toothbrush. Just like our toothbrushing, we want to get it covered. And then I'm going to take my dentures and I'm going to brush from the bottom of the denture all the way up to the top on all sides, from the bottom to the top, and we'd rinse them off with water as we're going, bottom to the top. I'm going to do the same thing on the inside of the denture, so bottom to the top, bottom to the top, and then I'm also going to get all of those biting surfaces, so those things that come in contact with food. I'll do the other one, but right now we're going to rinse this one off really nice and well. And we want to make sure that our water isn't too hot or too cold because it can warp or damage the dentures and crack them. So we want to make sure it's like tepid, lukewarm water. And then it's important to reinsert the dentures as soon as possible, but especially in long-term care, patients like to have their dentures out for sleeping or if they're sick, they really don't want to have it in. So in those cases, we will store our dentures in room temperature water, submersed, labeled with patient name, and stored somewhere that they're accessible for them. When considering oral hygiene, there's lots of different situations that people are in. Certain things to consider are their demographics, like their age. Our pediatric patients are going to have a lot of different things going on in their oral cavity, like baby teeth, loss of teeth, braces. So those are things that you won't see in the rest of the population.
Geriatric patients also have a lot of special consideration. The main things with geriatrics, as we mentioned, is that their oral cavity has mucosa that's a lot more fragile and it tends to dry out a lot more easily. So you need to be extra gentle as you're brushing their teeth, and you need to have a really good assessment of their mouth, especially if they have dentures. You need to assess if they might be fitting poorly, causing a lesion on their gums or anything like that.
And then, as you've seen a lot in our video with Juno, the level of consciousness of your patient is really important when doing oral hygiene because of the throat and the risk of like swallowing or not being able to swallow, all of that kind of thing. So your level of consciousness is really important. And on top of that, the kind of care you're receiving and what facility you're in is really important, because facial trauma in an ER is going to need different services, and someone who's intubated is different than somebody in an outpatient setting.
And as with anything in healthcare, just make sure that you're very careful about your hand hygiene, always performing it before and after everything you do.